Hi, my name is Mark Gottfredson, and I'm your Editor-in-Chief. Hey, welcome to part 3 of this 3-part series on how to get rid of your lower back pain. If you missed parts 1 or 2, go ahead and click on the link next to this video. Otherwise, kick back, relax, and enjoy the 3rd and final part of this series on how to get rid of your lower back pain.
This exercise is known as gluteal extensions. Carmen, I have her lying on her left side, just pretty much relaxed with her head and neck. If your neck and head are uncomfortable here, you can actually lay them down and use your arm as a pillow, something that's a little bit more comfortable. Okay? Starting with the bottom leg bent at 90 degrees, I have the top leg stacked right on top of it. So basically, as she looks down at her body line, this knee being too far forward, it would come into her line of vision, and that would be an incorrect way to set it up. So everything's in line with the length of the body. The muscles we're going to work on the posterior, the back side of the hip joint, are your glute medius, your glute minimus, part of the TFL, and the big glute muscle back here to do the work. So I'm going to have her bring the top leg up to about maybe 20-some degrees off the floor at the hip joint at that angle, maybe about 1.5 to 2 feet up. Turn the leg inward so the foot is pointed downward and the heel is up in the air. Bend the knee about 10 to 20% of it. If this is a 90-degree bend, I want her bent very, very little, not even half of that normal 90-degree bend, with the heel up the whole time. Now she kicks the heel so the foot goes straight again, or the knee goes straight. That kicks these muscles into play because of the internal rotation component of them. She keeps the heel up, she does it again, kick it out, bend the knee, kick it out, hold it, bend the knee, kick it out. This muscle group, keep going please. It's essential for this muscle group to be able to stabilize the sacrum, the pelvis, and the bone, the thigh bone, the femur that makes up part of the hip joint. As you run, and each foot is on the ground during the loading mechanism, as your heel hits and you start going toward the mid stance, these muscles increase their activity to stabilize you so that your hip doesn't jet out to the side. So when you run, your body isn't doing, as the foot hits, you're not doing this. This hip will actually, it will stabilize by strengthening the lateral component of that. As it relates to back pain, this is a major muscle group again. Really, there's no muscle that's not major, but the glute medius, glute minimus, and the big glute muscle they're helpful in stabilizing the entire pelvic girdle so that your sacrum, the wedge near your tailbone, is stabilized so that your spine can sit comfortably on a stable base. This exercise is known as sitting knee pillow squeezes. Sitting in a chair about 18 inches high, a chair that's high enough to keep your legs parallel with the floor, not something that's too low. If anything, you can bring it up another 2 inches so that your hips are 1 or 2 inches above. That'll give you some advantage to sit correctly. Don't sit toward the back of the chair. Come toward the middle of the chair. Leave some space. Don't sit all the way forward either, because it almost cheats to roll your hip forward for you and does all the work. Place a pillow or something hard between your knees. Feet pointed straight ahead, and that's crucial for you to keep your feet pointed straight ahead. Keep the weight on the inside of the feet. Relax your arms down to the side. I want you to roll your pelvis forward to put the arch in your back. So there's 2 ways to arch your back. Carmen could lean back, and that places compressive forces on the mid-back and low back, or roll your pelvis back like this, let it slump. Start from that position and just roll your pelvis forward and bring your torso with it to that position. So the mistake she would make is that she would throw her mid-back, her chest forward, to think that she's actually arching her low back with her hip. So roll the hip forward, hold this position. Now squeeze that pillow 20 times. And after 20, then roll your pelvis back to make sure you're in flexion, then roll your lumbar spine back to extension again, with the hip being the mover. This is a major spinal stabilizing exercise. It hits the primary hip flexor muscle, called the iliopsoas. It hits the inner thigh muscles to stabilize the hip. This will really help you with low back pain. As it relates to you being efficient as a runner or any other activity out there, this is another one that's going to really find those deep intrinsic muscles to make you efficient from point A to point B. This exercise is known as the counter stretch. At home, you're probably going to have to do this off of a kitchen counter, maybe with some books on top. Maybe something right around chest level, however tall you are. Base it on the bottom of your chest. Put your hands straight out, and that's going to be the counter height you're probably going to have to start with. If you don't have something like that, you can place your hands on the wall at the same level and do it that way. Right now, we're going to use this counter and this block. So Carmen's going to place her hands on the block, hands flat, fingers spread. Her goal is to back her feet up enough so that she ends up with a 90 degree at her hips. Holding that position, she can start in this position, and I want to take her pelvis and ratchet or tilt it forward to put the arch into her back, holding that position to create a nice curvature here in her spine. Now, she has a lot of hypermobility in her shoulders and back. She can drop lower than this. That's not what I'm looking for. So I want her to control it in this position and create the movement from the pelvis, tighten up her thighs, keep the weight on the inside of her feet, and hold that position for the allotted amount of time. You know you're getting a lengthening of your hamstrings, your glutes, and your calves because you're going to feel the stretch. The engagement or strength component of this is the forward tilt of the pelvis, the spinal erectors, the glute medius, the TFL, the deep six, the piriformis and its 5 little friends, all the rotation of the scapula, all the muscles that stabilize it, the rotator cuff, the serratus, the external oblique, the lats, the traps. All these things have to come into play as you're holding this 90-degree loaded position. The benefit to back pain is that the lengthening of the hamstrings is going to relieve some pressure that's pulling on the pelvis all the time. And then as it relates to you as a runner, again, this actually will lengthen the hamstrings, engage the low back to allow your hip to go through a more functional range of motion. This exercise is known as the modified floor block. Now it'll take anywhere from 5 to 10 minutes to get the result we're looking for, but this is a really good one, especially post-run. You can come back and lie on your stomach and let your body get used to the shoulder position, let your spinal erectors kind of let go. Carmen's going to lie on her stomach. We're going to place these 5 to 7 inch blocks underneath her arms. It's placed on basically the lower portion of her upper arm, the elbow, and the wrist. Her feet are pigeon-toed, so her heels are dropping out, and she's relaxed in this position. Her forehead and nose are completely flat to the floor. I don't allow her to turn her head. She's going to be breathing through her mouth. What she's doing is she's allowing her upper back to adjust to this new position propped up on the blocks. Her glutes and her hips are relaxed. You know that by her heels dropping out. And the key is to get these back muscles to change their length and tension based on the demand that's here and the relaxation of her pelvic girdle musculature. The benefit to the runner is that a lot of you are using your back muscles for too much of your work. This allows the body to shut them down and kind of take a break, especially after your run. And the benefit to low back pain is huge because the contractile tissue and how that affects the hard bodies, the vertebrae and the spine and the fascia that surrounds it, everything that's in here has to work as a unit, and this kind of teaches the body and reestablishes them working together again by relaxing the over-tight muscles. This exercise is known as the air bench. I'm sure a lot of you have done it if you've done any ski training or had one of those phys ed teachers that used to get upset at you all the time. We're going to have you walk your feet out away from the wall anywhere up to 2 to 3 feet. This is about a 2-foot span to the heel, and then the foot will be about another foot long. So to the front of the feet, it's about 3 feet away from the wall. She's going to bend down to where she's close to 90 degrees. That's good. Her thighs are parallel with the floor. Her knees are behind her heel a little bit, so that she's not compressing or creating any bad torsion or shear forces in the knee joint by bringing her ankle back. So I do not want the knees surpassing the ankle. So she should basically, you should be able to see your toes if you look down over your knees. Okay? Put the weight toward your heels, not the front of your feet, and push yourself to the wall, allowing your low back to sit completely flush or flat up against the wall. You're going to feel the work in your quads, and that's where we want it. We're actually trying to replace the back work with hip and leg movement, which is going to make you more efficient as a runner. This one, whenever you get low back pain, I would suggest trying this in the cats and dogs out for a quick fix. It should take away your low back should go away instantly, at least for a time frame, until you can get back on the menus that we're going to provide for you. So keep the weight in the heels and push yourself to the wall.
Hey, congratulations. By watching this series, you just made yourself a more intelligent runner. And wherever your running takes you, remember, peak running will be there, changing the way you run. One article